Good morning everyone, respected ma'am and my dear friends. Today I am Miss Risha Begum from BSc Nursing second year, roll number 48, going to present my seminar on the topic of blindness. Now I would like to give a brief introduction about my topic blindness. So the term blindness is a state of totally being sightless in one or both eye. It can be caused by various conditions such as infection, injury, cataract, glaucoma. Because of this etiological condition, the optic nerves are damaged, which is to transmit the information to our brains, and later it leads to blindness. It can be cured by various medication in the term of eye drops or pills. It also cured by surgery. It can be prevented by educate the children and the community people about its causes and risk factor. Also, we can create awareness regarding the eye injury among the community people.
Incidents in world 180 million people worldwide are visually disabled. Out of them, 45 million are blind. 80% of blind is avoidable. Major causes of blindness and their estimated prevalence are cataract 19 million, glaucoma 6.4 million, trachoma 5.6 million, childhood blindness greater than 1.5 million, and other 10 million. 32% of world blind are aged 45 to 49 years. 58% are greater than 60 years old. In India, annual incidence of 2 million cataract-induced blindness. National Survey of Blindness 2001 to 2002 shows prevalence of blindness greater than 50 years 8.5%, general population 1.1, 6 to 7% of children aged of 10 to 14 years have a problem with their eyesight. In Northeast, if we see, according to the Rapid Assessment of Avoidable Blindness Survey 2003, the prevalence of blindness in Assam is 3.05% and 2.28% in Arunachal Pradesh. As per the National Program for Control of Blindness, prevalence of blindness is in the country was 1.1% in 2001 to 2002 and 1% in 2006 to 2007. History of blindness. The history of blindness is difficult to chart. There are few examples before 19th century of sustained organized effort by the blind to act in concern to achieve collective goal. And prior to the 18th century, the history of blindness is automatic, consisting of stories of protagonists in religious and secular stories who wave in and out of popular consciousness, serve as object lesson or provide inspiration to the sight. Who was the first blind person ever? Wilhelm Meyer was the first blind person ever. He was born in September 23, 1968 in the New Jersey. At the 15-month old, he was diagnosed with the juvenile retinoschisis with blindness, the expected outcome by at age 13 years old. Coming to the definition, according to WHO, visual acuity of less than 3/60 is Snellen's or its equivalent. Visual acuity means central vision, the vision used to see details, and the Snellen is a chart which is used to measure the acuity. These charts have number of rows of letters which get smaller as you read down the chart. The first number is a distance of meter from the chart someone sees at a time of reading. The second letter is the ability of person to see the chart. It may be 60, 36, 24, 18, 12, 9, 5. It varies and decreases as it goes down. The larger the second number is, the worse you sight it. But first number is constant, that is, it might be 6 or 3, means 6 meter from the chart or 3 meter away from the chart. On the Snellen chart, normal visual acuity is called 6/6 or and 6/24 is moderate reduction of field of vision or vision that is cloudy or blur. So according to this chart, the blind person even cannot see the top line also. The next definition is in the absence of appropriate vision chart by non-specialized personnel, the WHO has now added the inability to count finger in daylight at a distance of 3 meters to indicate less than 3/60 or its equivalent. That means in the absence of appropriate vision chart, if we use fingers at a distance of 3 meters to calculate the visual acuity, the blind person is unable to count at daylight at a distance of 3 meters. Now coming to the types of blindness. First one is color blindness, difficult to distinguish green and red. Means here person have reduced ability to distinguish between color green and red. Next one is night blindness, difficult to see object in dark. That means a person have difficulty to see object in dark or at night. It is also known as nyctalopia. Next is snow blindness, temporary impairment in vision due to excessive exposure to UV rays. It is painful also. The next is complete blindness. That means person unable to see object in all circumstances. Next, legal blindness, central vision 20/200. That means legal vision is defined as a visual acuity of 20/200, that is visual field is limited to only 20 degree. The next one is temporary blindness, vision loss shorter period. The temporary loss of vision is caused usually in just one eye and lasts from second to minutes. It is causes due to the reduce of blood flow to the eye. Next one is permanent blindness. Vision is lost for lifetime. The vision acuity is lost for lifetime because of diabetic, trauma, infection, glucose, glaucoma, and inability to obtain any glasses. Then next is unilateral blindness, loss of vision in one eye. Then last one is bilateral blindness, loss of vision is both eye.
Now coming to the etiological factor of blindness, then first one is in infant. First one is infection such as pinky eyes, blockage of tear ducts. It can cause because of accident or injury which leads to blindness. Strabisms are also known as crossed eye. It caused because of problem with the eye muscles, the nerve that transmitted information to the eye muscles or the control center in the brain that direct the eye movement. It can also cause because of eye injury. The next one is amblyopia. Amblyopia is also known as lazy eye, is a vision development disorder which an eye fail to achieve normal visual acuity. Most common causes of lazy eye is an imbalance in the muscles that position the eye. In most cases, only one eye is affected, but in some it can occur in both eyes. The next one is ptosis. Ptosis or dropping of the upper eyelids due to paralysis or as a congenital condition, it can causes blindness. The next one is congenital glaucoma. Congenital glaucoma is usually diagnosed with the first year of life. This is a rare condition that may be inherited, caused by incorrect development of eye drainage system before birth. The next one is retinopathy of prematurity. The retinopathy of prematurity is occur in the premature babies when the blood vessels that supply their retina are not fully developed. In adults, glaucoma it is a rare Glaucoma, it is referred to different eye condition that can damage our optic nerve, which carries visual information from eye to brain. Then next one is muscular degeneration. Muscular degeneration here destroy the part of our eye that enable us to see details. It is usually affect in older adults. The next one is cataract. Cataract is an opacity or cloudiness of the lens which causes cloudy vision. It is more common in older people. The next one is lazy eye. Lazy eye can causes blindness. The next one is optic neuritis. Optic neuritis means inflammation of the optic nerves. Pain and temporary vision loss are common causes of optic neuritis. The next one is retinitis pigmentosa. Retinitis pigmentosa is a eye disease in which the eye's retina is damaged that cause severe vision impairment. And last one is tumors. Tumors that affect the retina or optic nerve can also cause blindness.
The signs and symptoms or clinical features of blindness are cloudy vision and inability to see shapes, seeing only shadow, poor night vision, and tunnel vision. And in children also we can see constant eye rubbing, poor focusing, and extreme sensitivity to lights, chronic eye redness, chronic tearing from their eye. Diagnostic evaluation. First one is ophthalmoscopy, also called as fundoscopy, is a test that allows a health professional to see inside the fundus of the eye and other structure using an ophthalmoscope. It is also done as a part of an eye examination. Next one is slit lamp examination. The slit lamp examination is a standard diagnostic procedure which is also known as biocroscopy. A slit lamp is a microscope with a bright light used during an eye examination. It is given our ophthalmologist a closer look at a different structure at the front of the eye and inside the eye. It is a key tool in determining the health of our eye and defecting eye disorder. The next one is color vision test. A color vision test is also known as Ishihara color test. It helps to measure our ability to tell the difference among color. If someone don't pass in this test, he or she may have poor color vision or doctor may diagnose as color blind, where we are only able to see the shadow or gray. Next one is Amsler grid. The Amsler grid can help detect early signs of retinal disease and monitor change in vision after diagnosis. The grid looks like a piece of graph paper with a small dot in the center. With reading glasses on, hold the grid at a distance that allows to get most of the line in focus. It will probably about the same as book distance cover or close one eye so that testing only one eye at a time. And patients with muscular disease may see wavy lines or some line may be missing. The next one is ultrasonography. Prevention of blindness. The component of action in national programs for the prevention of blindness comprise the following. Initial assessment. First one is initial assessment. Assess the magnitude, graphic distribution, and causes of blindness within the country by prevalence survey. Next one is method of intervention. Here, first one is primary eye care. With range of eye condition can be treated or prevented at grassroots level by locally trained health workers who are first to make contact with the community. They are also trained to refer the difficult cases to the nearest PHC or district hospital. Then their final object involve promote of personal hygiene, sanitation, good dietary habit, and safety in general. The next one is secondary eye care. It involves definitive management of common blinding condition as cataract, trichia, tricysis, uh, entropion, ocular trauma, glaucoma. It is provided in PHA and other district hospital when eye departments are established. It may involve the use of mobile eye clinics. The greater advantage of this strategy is it is problem specific and make best use of local resource and provide expensive eye care to the population at the peripheral level. The next one is tertiary care. Established in the national and or regional capital and often associated with medical college and institute of medicine, provide sophisticated eye care such as retinal detachment surgery, corneal grafting, which are not available in the secondary centers. Other measures of rehabilitation comprise education of blindness in specific school and utilization of their service in the gainful employment. Then next is specific program. Programs are controlled trauma, school eye health services, screening and treatment and health education, vitamin A prophylaxis, occupational eye health services. Then next is long-term measures. Long-term measures aim at improving quality of life, modifying or attracting the factor responsible for the parasites of eye health problem, poor sanitation, lack of adequate safe water supply, poor nutrition, lack of personal hygiene. Then last one is evaluation. Evaluation should be an integral part of intervention programs to measure the extent to which ocular disease and blindness have been alleviated, uh, assess the manner and degree to which program activities have been carried out, and determine the nature of other changes that may have been produced. The role of nurse. The nurse should educate all children starting from preschool age as well as educating the mothers about the risk factor and causes of eye injury. Nurse should create awareness regarding eye injury among the community or the general public through the mass media such as newspaper, radio, TV, etc. Nurses should advise the diabetic retinopathy and its subsequent complication. Nurses should connect patient to national organization which will help the patient by saving expenditure and further treatment. Nurses should monitor regular health and medical checkups for the premature children and pregnant women about the importance of breastfeeding, malnutrition, and antenatal checkups and hospital deliveries and personal hygiene, which may be the risk factor of blindness. The nurses should organize eye health services where students were taught to practice the principle of good posture, proper lighting, avoidance of glare, proper distance and angle between the book and the eye. Nurses should provide information to the patient and family members about secondary care and involve the use of mobile eye clinic and about the tertiary care management such as retinal detachment, surgery, corneal grafting. Nurses in rural areas should counsel about child marriage and birth spacing. Nurses should teach the patient about basic technique and skill that help the patient and to adopt a lifestyle that would minimize health risks. Nurses should provide primary eye care such as topical tetracycline, vitamin A capsules, eye bandage, slides, etc. Nurses should provide detailed information to the patient family member about the agencies and program for the assessment of patients such as National Association for the Blind 1952, the Royal Commonwealth Society for the Blind 1950. Now coming to the management, the treatment of blindness depends on the causes of blindness. Blindness due to nutritional deficiency, it can be addressed by the dietary changes such as provide vitamin A rich food. Visual impairment due to refractive error can be addressed by doing a refraction and providing appropriate spectacle. Inflammation or infection causes blindness can be treated by medication in the form of drop or pills. Most of people are blind due to cataract. Here, cataract surgery would be done. In most cases, restore their sight. Usually, an intraocular lens is implanted in the eye after removal of the opaque natural lens. The health education for blindness. Educate all children starting from pre-school age about object, event, and action that can cause eye injury. Educate the mother, the first health provider in the home. Create awareness regarding eye injury at the interpersonal level. For example, teach people about potential danger to the eye and what to do in case of eye injury. Create awareness regarding eye injury at the group level. For example, among groups sharing a common occupation or activities such as welders, football players, cyclists, and industrial workers. Create awareness regarding eye injury among the general public through opportunity mass media such as newspaper, radio, TV, etc. Advocate among the leader and policymaker to induce and enforce policy which will help prevent blindness from injury. For example, legislation for health and safety at work, the wearing of car seat belt, the banning of explosive firecracker, etc. Advocate on a global level on issues such as banning anti-personnel mines. Now I am going to conclude my topic, and today we will discuss about the blindness, its various types, etiological factors, clinical features, management, prevention, how can we prevent, and the nurse's role in prevention, also health education. I hope you all have understood this topic, and in future if you get any blind patient, you all can deal with this kind of patient. The goal of my seminar is to reduce incidence of blindness. Thank you, ma'am, for giving your valuable time to me. I would also like to thank my friend for cooperating with me, and I hope I could make you all understand. Then, thank you for your attention. With this, I end up my seminar. Thank you once again. And if anyone have any doubt, you can ask me.